Marcy Dondershine, and I'm an occupational therapist. And in 2007, there were symptoms that were mimicking multiple sclerosis, but come to find out I had a bulging disc at C5-6 that was bulging into my spinal cord. So I had symptoms all the way down my body. So I had a surgery for that, a subsequent surgery at C4-5 the next year. And since that time, I've had just chronic pain in my neck, loss of range of motion, pain that goes up the back of my neck into my head. I just haven't been able to find anything.
Pain?
The last surgery was 2009. So
7 years. How much pain from 0 to 10?
at certain times, it's been debilitating. At times, maybe a 7. Daily, it's like a
2 to 3, that's a constant pain. And you were mentioning stuff about your headache. Talk about it.
Yeah, so I get pain that goes up the back of my head, and it doesn't really come in here unless it's just seasonal allergy. But from the neck, if I sleep on a pillow that's too high, or if I'm doing a lot of neck flexion, like bending down over, I work with kids, then I get pain that goes up the back of my head. I really feel like I have loss of range of motion when I come this way, especially shooting pain down into this area.
Any other symptoms?
Once in a while, my arms will be achy, and I know that's from my neck because prior to my second surgery, that's how I knew another disc had bulged. I thought I'd broken my thumb. It was so achy. As soon as I get that achy feeling in my hands, then I know.
So can you tell me what type of treatment you had?
I've had physical therapy, more of just trying to release.
Manually with the hand, yeah.
And some manipulation for movement, range of motion.
Okay.
Which I feel like helped some during that time, but I never, after the surgeries, really got back to where I was pain-free.
All right. Did you have any other treatment other than... So everything we do here should not aggravate your symptoms.
Okay.
First, we're going to visually take your range of motion, extend and flex, and see how far. Please go back. And let me know where is the tightness.
And there's some tightness at the very end range of motion.
Occipital area?
Yes.
Flex. That's tight.
It's super tight down the right side. It just feels like a rubber band.
Okay.
And I've been trying to stretch by doing, holding this.
It left and right.
Again, that sends pain down into my trousers.
Okay. The range of motion, restrictive extension, and flexion. Let me work with you and make sure it's not with your symptoms.
Okay.
So the surgery was anterior.
Yes.
Okay. That's good. Feel this tightness? This is fascia tightness. It should move like this.
Oh.
Okay. I'm gonna release it. See how I feel with that. Any discomfort?
No.
Okay. How does this feel now? Can you tell? Can you feel mobility?
Should I flex?
Do that.
Oh, I can feel it a little bit. Doesn't feel tight going this way.
Let's just scoot forward a little bit. Try to release. Scoot in.
Oh.
Yeah. Do you have any back issue?
Not chronic. The other day I was holding my knees for a long time and my lower back was hurting a little
I
bit.
feel the tight.
All this is connected.
The whole body is connected.
Yeah.
Fascia layer is wrapping the entire body. It's like a Spider-Man suit, wrapping everything. We cannot separate it. So when we treat, it's wrong to treat body parts. We need to look at the system. You feel that tightness here?
Yes, I'm so tight.
That's a lot of fibrosis. Fibrosis is scar tissue. You feel those bump here?
Yes.
That's fibrosis scar tissue. This is like a small ping pong ball size.
Okay.
And I don't know, in the camera you can see the fibrosis sticking out here. You feel that? Nice and small.
Yeah. Yes.
See if you have the same thing on the other side. Okay. Can you tell the difference? Right? And you said it's more sharp in that
Yes.
side. Okay. You definitely have fibrosis in both sides. Okay. And you said an occipital area too.
Okay.
Okay. So you're gonna do that.
Okay.
So can you describe how the instrument feel in your body?
It doesn't hurt, like a rough grating, but no pain or anything.
Yeah. The rough part is because the fibrosis.
Okay.
The instrument is very, very small.
Yes.
You can discover
Not at all.
It's not too bad. You will notice if the area is smooth, you feel rough or smooth here.
No.
That's because there's no fibers.
Uh-huh.
When you feel roughness, that's because of fibrosis in the area. And Sometimes when we work with patients, especially IIT men, it feel like and sound like washboard. You know, flowing that. Like it's not too bad, not so clear. Okay. Move your neck left and right, and tell me how that feels.
No pain to the left.
Okay.
To the right, when I get all the way to the end, it goes up into here, and then down deep somewhere into there.
How much from 0 to 10?
Like a 4.
Extend and flex. Can you tell a difference with that?
I think so. At the very end, it doesn't feel as tight.
Yeah, it looks smoother.
Okay, it still feels tight on the right side.
Feel it right there. Okay. Let's actually lie your back here. Can come this way. This side. And free.
Okay. I think I'm too long for your table. I'm okay. I can wait till the album.
Feel the tightness here? Is that painful?
It actually feels good.
Any headaches wrong?
No,
You still feel the headache?
the headache's actually going.
Good. Can you just cover that?
It kind of hurts where your fingers are.
Make sure you let me under.
It's not unbearable.
I want to make sure you're not experiencing discomfort. Tuck your chin. Go. All right. Sit up. Turn left and right and tell me how this feels.
Okay, still on the right. I feel like I have more range of motion, but it still is going down into there.
Okay.
Maybe a little less, maybe a 3.
Feels deep on that area.
Yes.
Flexion extension is fine. Look at that. Full range of motion extension.
This doesn't hurt quite as much.
I didn't expect a lot of, you're going to get a lot of friction because the rod.
Yes, I'm feeling
So we'll have your hardware limitation. Do you feel it deep in this area?
the middle of my neck and back. When I turn that way, yes. I don't know.
Is that painful?
No.
Make sure it's not painful.
I like to
Yeah, sit up.
Definitely less pain. And I have more range of motion. I still feel some tightness and a little bit of pain. Maybe a 2.
Okay.
Not in the middle, just down this top of the trap.
This is much better. So you feel it on the top. Okay, let's line it back. Relax, relax. Okay, there's a workout, right? Is that painful?
Yes. Feels better. I get more range of motion. I still feel some tight, a little pain. I would still say maybe a 2.
Okay.
There.
Do 10 to the right. 10 turning to the right. In for 8, okay? Are you counting? If you're not counting, I'm going to do 200, okay?
Eight.
Relax. Okay, let's drink some more. And after that, you turn again and tell me how you feel. How's that?
It's much better. I feel a twinge, but much more movement without that sharp pain.
It's a good range of motion. I think that's your normal extension.
It feels just a little tight now, but I don't feel that sharp pain.
You have a big scar tissue, so we need to work on it a little bit more to get the full range of motion. Can you tell me what you think about the ASTR treatment?
It's great so far. It's amazing, really.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.